Let's focus on the state of Goa. As Rahul pointed out, they're dealing with the COVID-19 crisis. There have been several reports of apathy also, and that's why the opposition has lashed out at the government, because there have been deaths due to the oxygen crisis. The Goa government hence has been forced to finally break its silence. Goa Health Minister Vishwajit Rane has said that 350 patients have now been shifted from the old Goa Medical College building to the new super specialty block, and the old building is where all COVID patients are admitted and where every single night deaths were being reported. In a tweet, Vishwajit Rane assured people that the super specialty block will be commissioned at the earliest, and a 20,000-litre oxygen tank will also be commissioned. He said that it will happen today itself. There's also a full-blown political war over the COVID deaths in Goa, with the opposition Goa Forward Party attacking the Chief Minister for failing to stop these fatalities due to an oxygen crisis, even alleging that this is a result of a rift, a lack of communication between the Chief Minister and the Health Minister.
So many COVID patients have died inside Goa Medical College Hospital, and finally Goa's Health Minister Vishwajit Rane has broken his silence. And where does he do that? On Twitter. Through Twitter, he has said that over 350 patients from GMC have been shifted to this particular super specialty block. Here in the visuals you can see tonight only through ambulances all the 350 patients were brought to this particular super specialty block. But most important part of this tweet was Goa's Health Minister Rane is appealing to the Chief Minister Pramod Sawant to commission this block. So even if this place is still not commissioned, 350 people, 350 COVID patients have been shifted over here. So what is the government waiting for to commission this hospital? And is there no coordination between the Health Minister and the Chief Minister? Because he, through a public statement, through a tweet, he is asking the Chief Minister to commission this hospital. This is the state of health infrastructure in the state of Goa. With camera person Samir Shanbak, this is Saurabh Vakhtania in Goa for India Today.
The whole problem is with the infrastructure there. The pipelines are very old. And if I am suppose that Health Minister also wants record earlier saying that the maintenance needs to be done. The maintenance is taken care by the GSIDC, which is Goa State Infrastructural Development Corporation, which is headed again by the Chief Minister. I don't know what is GSIDC is doing. They are saying that the pressure cannot reach on the 3rd and 4th floor. Today morning I was coming from Ponda. I could see that, like a bullock cart, slow pace the trolleys were going in a tractor to the factory probably under a police escort. So if this is the situation as things are going on, I don't know, God only can save Goa.
And let's get you a detailed report now on the plight and the state of affairs in Bihar. This is a government hospital in Darbhanga which is treating COVID patients in a completely dilapidated building. You can only imagine how many lives are being put at risk. India Today's Rohit Singh gets you this ground report.
At first glance, this would appear to be an abandoned building. But in reality, this is a hospital. This is the Darbhanga Government College in Bihar. Even before it cares for patients, looks like the building here needs immediate emergency care itself. This building is the surgical unit of the medical college, where close to 100 COVID patients are currently being treated. But given the horrific condition in which this hospital is, even a recovered patient is at the risk of getting infected again. Inside too, the hospital is in a pathetic state.
मिथिलांचल और कोसी के मरीजों के लिए वरदान और लाइफलाइन कहे जाने वाला डीएमसीएच इस वक्त खुद लाइफ सपोर्ट पर चल रहा है। हम इस वक्त डीएमसीएच में मौजूद हैं, दरभंगा में आप देख सकते हैं, और यहाँ पर कोरोना के मरीजों का इलाज भी चल रहा है इस बड़े अस्पताल में। लेकिन इस अस्पताल की हालत कैसी है ये तस्वीरों के ज़रिए हम आपको दिखा रहे हैं।
खतरा पूरे लगता है पर सरकार इस पे कोई ध्यान ही नहीं देता है। ऐसा सरकार है ये। शुरुआती में जब लालू जी गए उसके बाद नीतीश जी आए तो शुरुआती में बहुत सारा डींग डांग दे रहे थे, ये करेंगे वो करेंगे। अभी तो साफ जर्जर है।
कभी भी गिर सकता है, कभी भी मरीज भी मरेगा और हम भी मरेंगे, कभी भी कुछ हो सकता है।
बाकी इसमें रहना खतरे से ये है।
नहीं है।
The construction department had earlier asked the hospital authorities to vacate the building due to its horrible condition. But after the COVID outbreak, patients continue to be treated here at the cost of their life and well-being.
हम लोग तो इसको आनन फानन में खाली करवा दिए, एक डिसीजन हुआ जो कहीं गिर जाएगा, लेकिन अभी कोविड का मरीज जो आने लगा है तो CCW यूज नहीं करेंगे तो कोई उपाय नहीं है। इतना मरीज तब तो जहाँ जो जगह है रिस्क लेके भी हम लोग पहले पेशेंट का इलाज कर रहे हैं और भगवान करेंगे पुरानी बिल्डिंग है, आजकल के नए बिल्डिंग के हिसाब से ही कभी नहीं गिरेगा, इसमें आदमी रहेगा तो उम्मीद है।
Next to this hospital of the horror is this building, which has been under construction for the last 5 years. But somehow it still remains incomplete, allegedly due to delay caused by the construction firm.
200 बेड का ये सुपर स्पेशलिटी अस्पताल है। 160 करोड़ रुपए की लागत से ये अस्पताल बनकर तैयार हो रहा है और 8 विभागों से जुड़े मरीजों का यहाँ इलाज होना है। उन्हें एडवांस ट्रीटमेंट की व्यवस्था यहाँ की जा रही है। लेकिन हालात कैसे हैं कि 2.5 साल बीत जाने के बाद, देरी के बावजूद भी जो है ये अस्पताल अब तक बनकर तैयार नहीं हुआ है।
जो एजेंसी यहाँ काम करने वाली है, जिसको सुपर स्पेशलिटी अस्पताल बना के हैंड ओवर करना है, अभी तक वो काम कंप्लीट नहीं की है। वो जब तक हैंड ओवर नहीं करेगी, उस काम को कंप्लीट नहीं करेगी, तब तक सुपर स्पेशलिटी अस्पताल कैसे 6-7 साल हो गया।
The ruling BJP-JDU government in Bihar may try to pass the buck on the construction firm, but the fact is that the delay has left hundreds of patients in the lurch. With Rohit Singh in Darbhanga, Bureau Report, India Today.
And let's continue getting you more ground reports, particularly from rural parts of the country where COVID-19 is spreading. A lack of facilities and equipment has given a rise to a number of quacks who are illegal doctors in rural India. People are now turning to those hospitals where there are no oxygen cylinders, no ventilators, and there are no medicines. Preeti Chaudhary visited one of these hospitals in Varanasi.
The rural belt in Uttar Pradesh is most vulnerable. Lack of basic healthcare has led to fly-by-night hospitals run by quacks, coming up and dismantling within hours, fleecing villagers. India Today met many villagers who paid upwards of Rs 40,000 even just a few hours of hospitalization with no facilities. Ramakant Pandya in Kashaiganj, Varanasi has lost his mother. There have been 7 deaths in his village in 8 days. With no bed available in any hospital, he and others in his village heard of Sunrise Hospital, 30 kilometers away from Chitaipur. It was new, opened 20 days ago when Corona was peaking in the area, and we are ready to take patients in any condition.
हम लोग सैनिटाइजर में ले गए थे वहाँ पर, तो वहाँ पर जो ले गए थे तो वो हमसे ले भर्ती तो कर लिए, लेकिन कोई दवा कोई इलाज कुछ नहीं किए। खाली हर मतलब वो जब पूछे डॉक्टर आ रहे हैं, डॉक्टर आ रहे, यही करते रहते हैं। और शाम को 7 बजे भर्ती किए थे और रात को 10:30-11 बजे तक डेट हो गया उनका।
Ramakant took his mother there. In 3 hours, she was dead. The hospital refused to release her body till over 40,000 rupees were paid to the hospital.
ऑक्सीजन लगा था? ऑक्सीजन भी नहीं लगाए थे, खाली बस आ रहे हैं डॉक्टर साहब देखेंगे तो ऑक्सीजन लगाएंगे, ये कह रहे थे।
बस ये कह रहे थे?
बस यही कह रहे थे।
उनका ऑक्सीजन लेवल चेक किए थे कि नहीं किए?
कुछ नहीं किए, वो एकदम टोटल कुछ नहीं किया। 6,000 का दवा भी मंगाए और दवा भी एक भी हमको मिला नहीं।
His neighbor Shiva took his mother-in-law to the same hospital. She died soon.
हमारे पास सुबह फोन गया कि उनका तबीयत थोड़ा गड़बड़ हुआ है,
तो वहाँ पर जाने के बाद तुरंत हम लोग यहाँ आए, यहाँ से आए तुरंत हॉस्पिटल लेकर गए। हॉस्पिटल ले जाते जाते उनको हॉस्पिटल वालों ने बोला उनकी डेथ हो चुकी है।
The locals in the area want an investigation into this new hospital, but no one has heard of them.
तो जो यहाँ पर कहाँ जांच हो, मतलब अस्पताल कहाँ लेके जा रहे हैं, क्या
यहाँ पे मतलब होता क्या है कि प्राइवेट में लोग लेके जा रहे हैं, नहीं ले रहे हैं। कपिल चौरा में लेके जाएंगे, वहाँ भी नहीं लेंगे। उसके बाद बीएचयू तक हम खुद वहाँ पे इनके साथ गए हुए थे, बीएचयू तक नहीं लिया। तो वही सनराइज प्राइवेट हॉस्पिटल में लोग लेके गए, सिर्फ वहाँ पे पैसे की व्यवस्था के लिए वहाँ मशीन द्वारा ये बनाया गया है। कोई ट्रीटमेंट नहीं है, बस सिर्फ उनको किसी भी कितना भी कंडीशन खराब आइए, 2 घंटा 3 घंटा रखिए, पैसा दीजिए, जाइए।
Our team went to the Sunrise Hospital 30 kilometers away, and what we saw was shambolic.
It's hospitals like these that have come up overnight because there is absolutely no space in the city to take in corona patients in the Varanasi district. Lots of complaints coming in of this hospital where large sums of money has been taken. Patients who are on the deathbed have been taken in, but even something as small as oxygen is also not administered.
A small basement taken over as a hospital. The owner, Dr. Mishra, at first said he didn't take any COVID cases, then said he had full machinery to deal with any eventuality. When we asked if he had a ventilator, later he took us to his ICU.
डॉक्टर साहब, आपका वेंटिलेटर ये है वेंटिलेटर? कहाँ है? बाहर किधर है? बता दीजिए, आप वेंटिलेटर दिखाने लाए थे, किधर है?
This is what we saw. COVID patients struggling to breathe. No ventilator, no BiPAP, no CPAP machines.
ये छोटा है ना?
कौन सा है? कहाँ है?
हेलो।
He soon disappeared from the hospital.
वेंटिलेटर दिखाने लाए थे, किधर है?
India Today team informed the local administrators about this hospital with zero medical facilities.
नाम बताइए डॉक्टर, आप डॉक्टर मिश्रा हैं क्या?
हाँ। हाँ।
दिखाइए जरा।
क्या दिखाए? नहीं दिखाऊंगा।
The tragedy is that even if any action is taken against the hospitals like these, collaterals will continue to be hapless villagers with little information. With Preeti Chaudhary, Bureau Report, India Today.
The Union government has accepted the recommendation for the extension of the gap between 2 doses of Covishield vaccine to 12 to 16 weeks now. And the COVID task force head, Dr. V.K. Paul, has clarified the reason behind this, defending the decision. He said that if you look at the protection level, it is affected from 60 to 85% on mild disease and severe infections. And increasing the gap of the vaccine has showed effectiveness in disease protection. He mentioned that increasing the gap between these 2 doses helps essentially in stopping the transmission. Dr. V.K. Paul added that there's no other reason behind the decision to increase the gap between the Covishield jabs at a time when there has been a lot of questions about whether this kind of a decision has been made amid a shortage of vaccines. Remember that UK is also inoculating its citizens using the same AstraZeneca Oxford vaccine, and they've reduced the gap between 2 doses. There will be only 8 weeks gap rather than 12 weeks, and UK has cited the variants of Indian origin as the reason for actually decreasing the gap between doses. And this is what has led to a lot of confusion. But the government maintains that the decision to extend the gap is a good one.
In real life, after this schedule being followed in UK, which basically means single dose, ये 60 to 85% तक इफेक्टिव है इन डिजीज प्रिवेंशन, कलेक्टिवली माइल्ड, मॉडरेट एंड सिवियर. सिवियर की प्रोटेक्शन ज़्यादा है कि कम चांस हो जाता है, माइल्ड की प्रोटेक्शन कम है, थोड़ी बहुत माइल्ड इन्फेक्शन हो सकती है. ये एक तथ्य सामने आया है. दिस गिव्स अस कॉन्फिडेंस. सेकेंडली, दूसरा तथ्य सामने जो डेटा के ऊपर आया, वो डेटा देखा गया पिछले हफ्ते कि ट्रांसमिशन में रुकावट आती है. ये प्रूव हुआ रियल लाइफ में. रिसर्च की सेटिंग में इतना प्रूव नहीं हो पाता, वो लिमिटेड नंबर होते हैं. एक वॉलंटियर यहाँ है, दूसरा तीसरे मोहल्ले में है, चौथा 5वीं सिटी में है. लेकिन अब रियल लाइफ में देने से ये एविडेंस मिला कि ट्रांसमिशन में भी प्रभाव है, और रियल लाइफ में वो 85% प्रोटेक्शन नहीं है, 65 to 85 है माइल्ड में, और सिवियर में लगभग. तो ब्रॉडली स्पीकिंग ये उनकी असेसमेंट है, ये सिंथेसिस है. इसकी डिटेल जो साइंस है वो भी अवेलेबल है, तो उसके बेस पे कॉन्फिडेंस मिला हमारी कमेटी को कि हम ये फैसला अब दे सकते हैं. तो प्लीज डू नॉट सी एनी other reason behind it. I plead with you as scientists, as a professional.
Now, there's also been a lot of discussion on the treatment of COVID-19 in India, the kind of drugs that are administered. Here's a detailed report on the COVID management protocol in India.
There has been a lot of back and forth and noise around India's treatment protocol. The spotlight is back on what has India recommended and what it hasn't to manage cases of COVID-19. It must be noted that none of the drugs used in India right now are new drugs. They are all drugs that have been repurposed, which means they were made for treating some infection and now are repurposed to manage patients of COVID-19. Let's try and explain to you what the clinical management protocol in India is right now. The most recent one, updated in the month of April, says that in case of mild disease, there is upper respiratory tract symptoms like fever without shortness of breath. Home isolation and care at home is suggested. The must-dos here are physical distancing, indoor mask use and hand hygiene. Hydration, anti-tussives and multivitamins are to be given to the patient in consultation with the doctor. Monitoring of oxygen and temperature is to be done. Immediate medical attention must be sought if there is difficulty in breathing, high-grade fever, and if there is cough. Well, if these symptoms persist after 5 days, then must consult with the doctor about moving the patient out of home isolation. Therapies based on low certainty of evidence are ivermectin, which is to be avoided in lactating and pregnant women, or hydroxychloroquine, unless contraindicated, and inhalational budesonide. Ivermectin is a medicine used to treat all kinds of parasite infestations. In humans, this includes head lice, scabies, river blindness. Hydroxychloroquine is a medicine to treat and prevent malaria. Other uses include treatment of rheumatoid arthritis, lupus. Budesonide in the inhaled form is used in the long-term management of asthma and chronic obstructive pulmonary disease. Recently, Soumya Swaminathan, chief scientist of the World Health Organization, had said safety and efficacy are important when using any drug for a new indication. The World Health Organization is recommending against the use of ivermectin for COVID-19 except within clinical trials. The company that makes ivermectin, Merck, has also said that there is no meaningful evidence for clinical activity or clinical efficacy in patients with COVID-19 disease. The company flagged a concerning lack of safety data in the majority of studies. But this continues to be a part of India's treatment protocol. Moving on to treatment for moderate disease. How is it defined really? In moderate disease, the respiratory rate is more than 24 every minute. There is breathlessness. The oxygen saturation rate is below 93. The advice by the government is to admit the patient in the ward. The target SpO2 should be between 92 to 96%. The preferred device for oxygenation is a non-rebreathing face mask. Awake proning in patient is advised. Anti-inflammatory or immunomodulatory therapy is advised. Injectable methylprednisolone is to be prescribed or an equivalent dose of dexamethasone. Anticoagulation, which is conventional dose of unfractionated heparin or low molecular weight heparin, is advised. Clinical monitoring of breathing or hemodynamic instability or change in oxygen requirement is to be done. Here, HRCT chest is to be done only if there is worsening of the situation. CRP and D-dimer is to be done on a 48 to 72 hourly basis. CBC, LFT, KFT are tests to be done, and also IL-6 if the levels worsen. So what are the medications then? Dexamethasone is used. What is dexamethasone? It is a glucocorticoid medication, a steroid used to treat rheumatic problems, a number of skin diseases, severe allergies, asthma, chronic obstructive lung disease, croup, brain swelling, eye pain following eye surgery, and along with antibiotics in tuberculosis. Medications like remdesivir and tocilizumab and convalescent plasma also is explored when the patient is suffering from moderate illness. Let's tell you what these drugs are. Remdesivir is a drug made to treat Ebola. It's a broad-spectrum antiviral medication. Tocilizumab is also known as atezolizumab, is an immunosuppressive drug mainly for the treatment of rheumatoid arthritis, and convalescent plasma is using blood from people who've recovered from an illness to help others recover. It's used for other illnesses as well. This is to be done within 7 days of the onset of the disease. Severe disease in COVID-19 is when the patient's respiratory rate is more than 30 and oxygen saturation is less than 90. Here, use of NIV in patients with oxygen requirement, also HFNC. Intubation should be prioritized in these patients. Using conventional ARDS net protocol for ventilator management is advised. Here as well, dexamethasone is advised, also use of heparin. Also, HRCT, CRP, D-dimer and other blood tests are prescribed. So while this is the treatment protocol to be followed by doctors, it is important for all of us to know what happens in the 3 stages of infections and how drugs are administered and which ones are administered at which stage.